very good afternoon to you all. Myself, Dr. Sumedha Gupta, and on behalf of Voice of Healthcare, I would like to welcome all the viewers who have joined us. So, the topic of today's session is Heroes Fight for Health. Join the Prostate Cancer Awareness. And this initiative is supported by Zydus Life. Prostate cancer is a significant health concern in India, ranking as one of the most prevalent cancers among men. According to WHO data, prostate cancer accounts for approximately 7.7% of all the cancer cases in Indian men, with an estimation of 105,000 new cases reported this year. Additionally, it is a leading cause of cancer related deaths with around 30,000 fatalities in 2020 alone. These statistics highlight the urgent need for enhanced early detection, prevention strategies, and treatment options in order to address the growing impact of prostate cancer in our country. So, in this session, we are going to discuss and highlight the holistic prostate cancer care by integrating physical, emotional, and psychological support. To begin with the discussion, first, I would like you all to join me in welcoming our expert who is going to provide us with insightful information on understanding about the prostate cancer awareness. I would like to welcome Dr. Prashant Pandey, consultant hemato and medical oncologist, BP Podar Hospital and Research Institute. Good afternoon, Dr. Prashant. Welcome to the discussion.
Thank you. Good afternoon to you. Thanks for giving this opportunity so that I can express my thinking about the prostate cancer to the general people. So we can start now, please.
You're welcome, Dr. Prashant. So let's delve into the discussion. So to begin with the discussion, Dr. Pandey, I would like to ask, what are the most pressing gaps in the prostate cancer awareness in India right now, and how we can effectively address all these gaps to enhance the public knowledge or the patients suffering from prostate cancer?
Yeah, you have beautifully explained what is the incidence and the growing rate of the prostate cancer now in the worldwide. Even the India is not less than that. So, considering our India, there are a lot of significant gaps about that contribute to the future direction and the poor outcome. According to my knowledge, I should ask you that lack of awareness and understanding is the first one, because there is limited awareness about the prostate cancer among the general population, especially if we are going to talk about the rural areas problem. Men often do not know the symptoms, even the risk factor, or the what is the importance of early detection. So, lack of awareness is the prime factor, and for deal to that we can go for the public health campaign, like launch of nationwide campaign in the multiple languages through the media, maybe the TV, radio, newspaper, and other digital platform like Facebook or WhatsApp. These things, and these campaigns should actually focus on the educating the men, particularly those men who are above the 50 years, and about their risk of prostate cancer is very high, and also
Yes.
to facilitate them for the regular health checkup. Sorry. Second thing, we can also incorporate this prostate cancer education program in general health program by consulting our government things. Okay, government health scheme can spread the awareness and about the prostate health. Second one, what we think that the culture is stigma and gender related taboos. So as we know
Yeah.
that discussing around the male reproductive health are often stigmatized in our country, even in our society too. And these cultural barrier actually prevent open conversation about the prostate cancer. So our first duty is to communicate, to engage the community through the various leaders, the community workers, so that they can actually talk about the this cancer related thing or your reproductive system things. And the second thing,
Yeah.
if anybody who has found out the cancer, we also should go for the support program and supporting the things. There are a lot of gaps. Second, third thing, what we are facing the late diagnosis due to lack of routine screening. Okay, so we should go for the regular screening for the high risk group, where those patient who have the obesity, or there is a family risk factor. The family has affected with the prostate cancer, pancreas cancer, ovarian cancer. Some a family are born to go for the some genetic nutritional changes, and that too related to this prostate cancer. Hello. Yeah. Hello. Hello.
Dr. Prashant,
Yeah. I'm audible.
am I audible to you?
Yeah. Yeah.
Yes, you're audible to me.
Yeah. So
So,
the
thank you, Dr. Prashant.
hello.
Am I
Hello.
audible?
Hello. Hello.
Hi, doctor. Please wait. I think there is connection issue with Dr. Sumedha.
Oh, yes, sir. Because I am, your voice is audible to me, sir.
Okay, she is joining. I think.
Okay.
Dr. Prashant, am I audible to you now?
Yes, you are audible. Hello.
Hi, Dr. Prashant, am I audible to you now?
Yes, yes, now you are audible.
Sorry for the interruption. Actually, there is some network issue, technical glitch.
No issue.
Yes, please continue.
Yeah. So, towards the conclusion is that the improving prostate cancer awareness in India requires a combination of the education, healthcare, accessibility, and the third and most important is cultural changes and government intervention. So I think the engagement in community level outreach, promoting the regular screening and providing accessible healthcare service, especially to un, unreserved reasons, will go long way in closing all these gaps and improving prostate cancer awareness. Hello,
Yeah, hi, Dr. Am I audible to you, Dr.
hello. Yeah, now, yeah, 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 you are audible. You can continue.
Hi, Dr. Prashant, am I audible to you now?
Yes, yes, you are audible.
Can you
Yes,
hear
you are
me?
audible. Yeah, yeah. Hello.
Hi.
Hi, Dr. Sumedha.
Hello. Can you hear
You
me
are
now, Dr.
audible.
Prashant? Great, great, great. So let's continue. Since you mentioned about the education campaign and to provide the education with the help of government and other caregivers to the people out there who are suffering from prostate cancer, I want to know your views. How can we tailor the education campaigns to different demographic region to ensure that the prostate cancer awareness reach diverse communities very effectively?
So I told you in the first thing that the lack of awareness and knowledge. So I think every man in India should aware of the importance of breast prostate cancer screening, considering the symptoms of the disease or the benefit of early detection. There is a misconception about the prostate cancer and screening method, and that too should be clearly explained to the or in the general population through our social media or the government intervention. We should try to reduce the fear and anxiety about this cancer screening part, because when we are going to tell the patient about the screening, there is a two method of screening. First, go for the digital examination, and second is the blood sampling. So these digital rectal examination actually produces fear and anxiety to the patient population. So we should clearly explain them and talk about them to reassure that this is not the problematic issue. Third, we have to go for this social culture and social taboos, because in India there are different languages, different religion, different social norms and culture and belief, and that may discourage men for talking about and prioritizing their health. So, we should promote community-based intervention where the health profession and education engage the men in informal setting. Religious and local leaders should come up with their ideas to break the taboos by addressing the prostate health and cultural sensitive standpoint. So, second thing is the most thing is that low doctor and patient communication. What we find out that there is a healthcare providers are not always initiative conversation about the prostate health during routine healthcare checkup, leading to missed opportunity for the education and screening. So I should urge to the community-based doctors to engage with the general, especially the general practitioners and primary healthcare physicians to proactively discuss the prostate health with their male patient, particularly those patients who are above 50 and a risk factor are present like family history of prostate cancer. Third and fourth, what we say that that a strategy to overcome the barriers of India, we have already discussed. We should engage local health worker, NGO, community leader to bring about the awareness of the rural population and offers mobile health screening too. And the sixth one is the financial thing. When we are talking about the cancer, the financial, or we can say final toxicity is the most important one. So screening and treatment of the prostate cancer can be costly, especially for men without health insurance and other
Yeah.
adequate financial backup. So our government and non-NGO should offer free of cost this standardized screening program to reach the rural population. And they should also develop partnership between the government and the private sector can also improve to the affordability and accessibility of these screening services. So I should say that these changes will merely fill the gap and actually in the different sector, so that our screening and the detection program can reach to the every population, every part of the rural India.
Thank you, Dr. Prashant, for these wonderful insights onto that. Since you talked about the different religion, different norms, and different demographic region, so what are your views onto that? That if we tailor the education campaign in that way, that it spread awareness with the help of digital media. So, what do you say that what role does the digital media play in promoting prostate cancer awareness, and how we can leverage the online platforms to maximize the outreach and engagement out there?
Uh, so this is the new world where digital media is growing very fast, and the impact of digital media is with every aspect of our life. So this cancer awareness should not be left alone. So India, as we know that India is one of the largest internet user globally. So million of people are accessing our internet platform daily, like Facebook, WhatsApp, Instagram, everywhere, Twitter. So the first thing that we should actually in digital media should offer easy access to the credible and up-to-date information about the prostate cancer if part of screening. its result, its treatment. So the website, blogs, and video from the medical expert can educate people about the symptoms, prevention, and treatment of the prostate cancer, offer in the various language. It's not limited to the either English, Hindi, or Bengali. Okay, it should be every part, every local language should be given same important. Second thing, what we hear does not impact too much. So the visual content of the prostate cancer campaign can leave his so infographic animation and the video content to make the complex medical things in the easier and understandable form. The platforms like YouTube are especially very much effective in doing this. So support of the communities, online forum, there are many online forum and support groups where we can uh, uh, connect the survivor, the prostate cancer survivors, so we can set the example of them, that those who have screened early, if we have found out the disease and we have treated them very efficiently, they are now cured. So these set of example uh, can be made through these digital platforms. Second thing, there is a high influencer in our society, the maybe the Twitter, Instagram, or Facebook. So we can incorporate them to just uh, uh, spread the awareness of prostate cancer in effective way. Second thing, the actually um, we can also go for the collaboration of the healthcare influencer with the celebrities like film star, cricketers. And second thing, that the partnership with the digital media, digital platforms, pan social media, social ads, where we can just target our audience to go for this cancer awareness and the treatment program.
Thank you, Dr. Prashant, for these insights. And I think you rightly mentioned about the support groups where people can interconnected with each other and can share their experience. So, if we talk about the holistic prostate cancer approach, in your view, can you explain how a holistic cancer approach address the comprehensive need of prostate cancer patient beyond the standard medical treatment that is provided to them?
So first, we have to understand what is holistic care approach. So there is one approach that we are going to treat the patient or screen the patient, but the patient who has been diagnosed with the cancer, there are another way, the other aspect where we can give relief to the patient. And this is the holistic care approach where we can address the comprehensive need of the patient by considering not only their physical health, but also their emotional, psychological, social, and spiritual well-being. So this approach goes beyond the standard of medical treatment such as surgery, radiation, chemotherapy, target therapy, immunotherapy, okay, hormone therapy. So the entire things, when we are talking about the holistic approach, we will go for the beyond this all kind of targeted management. So from our side, the nutritional support, a patient may receive dietary advice to help is the boost their immune coverage system, manage their weight, promote their overall health, like emotional and psychological support with the psychologist. So mental is the most important one in the pen in a cancer patient. A cancer patient who is actually in the anxiety, depression, and fear and stress of all those things. So mental health is important. So we also need the emotional and psychological support from the psychiatrist, the body image and self-esteem. So when we are going through the chemotherapy or radiotherapy or the targeted therapy, what happens? There is a physical changes, and that causes prostate cancer treatment can affect the self-esteem too, especially concerning the sexual function, body image, and psychological support needed for all these things. These are the things where this is attributed to the body. But what about the other things? Other things, the social support and the relationships. So we have to, the patient who had a prostate cancer can strain relationship with the partners, actually with the society. So there good and positive relationship should be established with the society and other members of the family members. Because when we are talking to the patient relative, many of the part of the India, what they think that the cancer is a actually infective disease. So they generally the people what they do, they segregate the patient, isolate the patient.
Yes.
That should not be done. And these things should be taught to the patient and patient relative or the society too that cancer is not an infective disease. So apart from this, spiritual care, yoga, lifestyle modification, and these are the things where we are going for the holistic approach. And the last time, not the least thing, is the end of life care, or we can say the palliative care, where we can't go for any kind of treatment. The patient is beyond the treatment. For that patients, where there is only need is to go for the pain management, maintain quality of life, okay, and sorry. So this part only includes the support for making the patient quality, life quality good and uh, in a in a productive way. So this holistic approach need the family involvement too at this point of time. Next, please.
Thank you, Dr. Prashant, for these wonderful insights. Since you mentioned about the emotional health of a person, in what ways the person can integrate certain aspects to maintain their emotional health and psychological health to maintain the overall well-being during the treatment. So, what recommendations you want to give to the patient out there?
So as we have talked the holistic care, in that holistic care path, the complementary therapy can be also be there, and that too is for all cancer. It's not limited to the prostate cancer. So by we it the actually this therapy do not replace the medical therapy like surgery, radiation, or chemotherapy, but it's complement with them. So just like
Yeah.
example, acupuncture. For the acupuncture, what we get the benefit that the patient may help from the reduced pain, nausea, fatigue, particularly in patient who is undergoing hormone therapy, where there is a fatigue is the important problems. Okay. Second thing, massage therapy. Okay. Third, yoga. Uh, somewhere meditation, mindful, nutritional counseling, herbal and supplementary therapies, exercise, the most important one, and other way of the physical therapy where the patient can go for the can reduce the not only anxiety but in some aspects some pain too. And now there is one other things, the musical and art therapy also, and these will engage in creating like music or art can emotionally and therapeutic increase the well-being of the patients. So there is another one is aromatherapy, where what
Yeah.
we do is the diffuse message and over the body to reduce the stress, improve mood, alleviate symptoms like nausea and insomnia. Those patients who are undergoing the chemotherapy or targeted. So by integrating all these complementary method of therapy in prostate cancer care, patient may experience improvement of their physical, not only limited to the physical, but also emotional and psychological health, leading to the better overall and well-being during their cancer journey. Next.
Thank you, Dr. Prashant, for the wonderful insight. Since we talk about the emotional health of a person, physical health of a person, but when it comes to dietary part, what recommendation do you want to give to the patient out there who are suffering from prostate cancer in order to maintain their diet?
So the first and important thing is that hello,
Yeah, you are audible to me, Dr. Prashant.
yeah, yeah. Huh. So diet actually, and in any cancer patient, it's not limited to the our prostate cancer. Cancer means there will be the problem in digestion. Actually, there is a loss of appetite. Okay, there will a hypermetabolic statement. That means the body actually need lot of energy. It's not for our daily routine work, but for the cancer too. The cancer cell too needs energy to grow. So whatever we are doing, either in the treatment form, whether it's a chemotherapy, radiotherapy, or target therapy, so these will produce some toxicity too, and these toxicity includes your loss of appetite, loss of taste, okay, vomiting, nausea, and this will actually apprehend the patient from the food. So from our side, uh, first thing, the patient should take lots of protein food, the rich food rich in a protein. The patient could not take a large amount of food at one time. Okay, so it is advisable to take a small quantity of food, but in frequent intervals. So if you want to take some food, uh, just take it in small quantity, but in frequent intervals. So ultimately, it will accumulate the large energy at the end of the day. Second thing, that there are some medication too that will increase the appetite, because in our cancer patient who are undergoing treatment, the main thing is the patient can't take food due to loss of appetite. So any appetite enrichment method can be used, either that may be what we have gone through the holistic approach, or some medical things where we use some medication, but that too is, their data is not so strong to prescribe for the appetizer enhancer medicine, but still we are using some of them. The thing is that high calorie, protein rich diet is the best for the cancer patient who is undergoing treatment or who is in a journey of cancer.
Thank you, Dr. Prashant, for the wonderful recommendation. And I think this is going to help the people a lot out there who are suffering from prostate cancer. So, Dr. Prashant, in your views, what are the most common side effects of prostate cancer treatment, and how can it be managed by the people through the physical interventions?
So, if you are going uh, about the side effect of the treatment, so we can just divide the side effect due to disease itself and the side effect due to the treatment related side effect, what we say. So
Okay.
disease related that side effect, disease itself produces the symptoms, that is the most important one: increase of frequency, urgency of the urine. But apart from this, there is also bony pain. That is the important one, and that generally occurs when the patient presented with the last stage of the patient, when there is a bony metastasis actually. So these are the things that is produced during the uh, cancer uh, uh, evolvement from, but this is not limited to the cancer disease itself, but also the treatment what we are going to provide the patient. Like when we are giving the chemotherapy side effect, like from alopecia to the nausea, vomiting, all those, loss of appetite, there is a bone marrow suppression. These are the all side effect which the patient get during the treatment. So these all side effect can, hello,
Yes, Dr. Prashant, I can hear you. You're audible to me.
okay, just a minute. So these all side effect, if if uh, if we are going one by one, that we should explore uh, that if the treatment related side effects is there after the chemotherapy or radiotherapy, that should be efficiently managed by the medication to some extent. And the disease producing side effect or disease producing symptoms is generally managed by the treatment. When the patient is undergoing treatment, these symptoms actually subsided by the treatment. Like if there is a bony pain, either we can go for the surgery, radiotherapy, or hormone
Hmm.
therapy. In that case, the bony pain subsided. Next.
Thank you, Dr. Prashant, for these insights onto that. And in the end, to conclude, I would like you to please provide us with any advice or recommendation to the patient who are suffering from prostate cancer and are newly diagnosed with this disease.
So the for from my side, for newly diagnosed prostate cancer, navigating the next steps. That means first of all, understand the diagnosis. What is the diagnosis actually? The type and stage of the cancer. First of all, because your type and stage of the cancer actually determine the treatment and the prognosis. Second thing, that if you was diagnosed with the cancer, prostate cancer, don't afraid, seek a multidisciplinary care. That means you should go to the hospital where we will find the medical oncologist, radiation oncologist, neuro oncologist, all in the same place, so that you can take suggestion from each one of them, and where the treatment should go through the multidisciplinary thing. Third thing, understand the all the treatment option that is given, because at that some point of time, the your doctor or multidisciplinary team will left the treatment decision to you. Like in stage 3B, where the multidisciplinary team asks you whether you want to go for the surgery or the radiotherapy. Okay, so just explore all the treatment option. Fourth thing, that if they are considering about the, because prostate cancer is genetic related, so if any patient who is diagnosed with prostate cancer and in his family, if his mother or father had a prostate cancer, mother had ovarian or breast cancer, so he should also consider genetic testing or genomic testing. So when you have already diagnosed with the prostate cancer, go for the lifestyle and supportive care. The important thing, do a insurance and the financial planning before the treatment started, because financial toxicity, apart from this cancer thing, is the important one. So ensure your insurance cover for the necessary treatment. Consult
Yeah.
all the way for the surgery, chemotherapy, hormone therapy, radiotherapy to your financial advisor, and educate yourself regularly about the disease, its prognosis, its treatment option, and regularly follow up. When your treatment has been ended, please don't stop follow up, because at some point of time you are cured. Now you stop the follow up. There is high chance the cancer may recur. So continue your for regular follow up as advised by your doctors. And the last one, being proactive, ask question, engage in shared decision making with your healthcare team at a critical area, ensuring that you should receive the most effective and personalized prostate cancer. Thank you.
Very wonderfully explained, Dr. Prashant. And I think this is going to help a lot the patient who are suffering from out there from the prostate cancer. So, in the end, to conclude, our objective for today's discussion was to explore and emphasize the importance of holistic prostate cancer care by integrating physical, emotional, and psychological support. And I'm confident that our experts have addressed the topic very comprehensively and effectively in a thorough and very effective and accessible way. I would like to extend my gratitude to Dr. Prashant for his insightful contribution and for sharing the expertise with us. Thank you for joining us today and for contributing the important discussion, Dr. Prashant.
Thank you. Thank you very much.